Hello again. So today I'm going to talk about our out-of-town patients, which we see quite a few of since I invented the SOOF lift, and I've been doing all these deep plane lifts, and I've probably got more experience than almost, not too many other doctors have more experience than I do in how to do a rhinoplasty, so that's an important point. And of course, the segmental brow lift, which is also an innovation that we teach, or I teach. Anyway, so I get patients that come to see me from outside of the greater Charlotte area, farther than like an hour or two drive. So I get patients from west of the Mississippi sometimes. I get patients from up east, down in Florida. I've had a few come across the pond, which is kind of cool, but obviously that's not the majority. Anyway, so how do we manage those patients? How do we manage patients that don't live close by? So there's no short answer for that. It kind of depends upon what they're interested in, obviously. So there's different parts of it. So how do we manage the pre-op part? Well, manage that is pretty easy. With Zoom now, most of those patients have their initial consultation done by Zoom, which is a good way to get to know somebody, for them to get to know me, and me give them ideas of what may or may not be appropriate for their particular issues. Never going to be as good as seeing people in person, but it's otherwise informative. I get to look at their health history and give them a pretty good concept of what they will ultimately need. I've been doing this for so long that I tell those patients that they don't necessarily have to come in to see me before they schedule surgery. It's up to them. I can literally sit down in a room with a patient for 5 minutes and just figure out what they need done. And that I can do the morning of surgery. I feel very comfortable doing that. However, some patients want to meet me in person before surgery, and that is their prerogative. That's what they want. Then they schedule an appointment and fly in here to see me before they schedule surgery. So it really is, that's patient dependent on how comfortable they are just with a Zoom visit. Post-op, it really is case dependent. So most of my, let's start with facial rejuvenation. Most of those patients stay, or I want them to stay, require, I should say, them to stay in town for the first 6 days. Now, if they live like an hour away, they can go home on day after the first day of surgery, not the day of surgery. But if they live, far away, plane ride away, or whatever, it's they need to stay in town for 6 days. I prefer they stay in town for the first 2 weeks, but sometimes I don't get everything I want. So those patients typically bring a caregiver, a spouse, whatever, friend, relative, whatever. And they stay, we have several hotels, very nice hotels that are within a block or two of the office. And my staff recommends, gives them that information, and they make their appointments appropriately. So the first day after any surgery that includes significant rejuvenation, I typically need to see the patient back in the office the following day to check to see how they're healing, remove any dressings that we may have used. Sometimes they have drains that we have to manage. So that's patient dependent. So that's kind of the rejuvenation patients, making people look younger. So then at day 6, when I see them, I'm again managing rarely at that point are we managing drains. The drains are typically gone. But we're mainly looking for infection and post-op bleeding, and we're also removing sutures and staples. Day 13, same thing. We change their directions a little bit in terms of what they can do, and we remove all the remaining sutures and staples. But again, we're looking for infection mainly at that point. And at that point, they can leave, of course, and go home. I don't need to see them for until around 2 months post-op. Lots of times that visit can be done by Zoom. It depends on the patient. Of course, they can't get post-op photos if they don't show up, but it's always fun to have those. People like to see them, the difference. So that is up to them. We follow all of our patients for up to a year. So see them 2 months, and depending on what I find, there might be issues that we need to address, like maybe they need some ultrasound to help with some swelling issues or whatever. So there are little things we can do as they're healing to speed things along that if they lived close by, it'd be a lot easier, but most of the time that's not necessary. So that's rejuvenation. The other, of course, category is rhinoplasty. See a lot of those folks that come from afar. Again, same thing. Zoom, fine. Not as good as the actual exam in person. Again, I can see them the morning of surgery and figure out what they need done. Again, if they're not comfortable with that, then they need to come in and see me and have an actual exam before they decide to have surgery. That's fine. That's really patient dependent. Post-op, I don't need to see them until day 6. So they literally, if they can drive home, they can go home. I don't require, or I don't advise them to fly, because the post-op stuffiness of the nasopharynx would make it uncomfortable and maybe even medically risky because of the eustachian tube dysfunction, and middle ear function is not normal for those first several days, and they could get severe ear pain or even a ruptured eardrum. So not a good idea that first 6 days to fly. We do see them at day 6 change their cast to tape. So there's 2 weeks having something on the nose. Most patients, after the packing's removed and the cast is changed to tape, most patients do come back at day 13. That is not a requirement. That can be done via Zoom in some patients if it's necessary. And then again, if they're healing within normal limits, which mainly what we're looking for in rhinoplasties is post-op bleeding. Rarely do we see any sign of infection. That's very uncommon. Could happen, but and we look for that too, obviously. But a lot of those patients may need taping, may need steroids. I can tell that on Zoom exam, and I can give them directions on how to tape, but I can't do the steroid injections. So if they need that, they either need to come back or, they need to come back at some point and do those injections. I've had patients that have come back, most recently from Miami, a patient that flew up every 2 months, got her injections, and flew back, and she's doing fine now. But some patients need a little help along the way with because they like to form scar tissue. Most patients don't, but anyway, so managing a rhinoplasty can mostly be done from afar, except for the first 6 days. So that about covers it. And I hope you found that informative, and have a good day. Bye.